afternoon, everyone, and welcome to this meeting of the Social Care, Health and Wellbeing Scrutiny Committee on the 3rd of December 2020. Just to make you all aware, today's meeting will be recorded. Can I also welcome any members of the public and press to today's meeting? Can I kindly ask you to observe the meeting only and not speak or participate? Can I please remind you all to switch your phones to silent for the duration of the meeting? In addition, can I refer you to the protocols for remote meetings which have been previously circulated, namely, your microphones should be switched to mute unless you are speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand via Teams. I will assume that you have all read the paperwork before us today prior to the meeting. Please only use the chat function to indicate if you wish to speak as an alternative to the electronic hand function or to raise any technical issues. When asking a question, can you please indicate which page number you are referring to? The first item on the agenda is to do a roll call. I am Councillor Lynette Purcell, the Chair, and I am present. I will now call on Charlotte, the Democratic Services Officers, to take the roll call.
Yes, Chair. So I've marked you as present. Councillor Charlotte Goldsworthy. Councillor Arthur Davis.
Present.
Oliver Davis.
Present.
Councillor John Miller.
Present.
Councillor Suzanne Patterson.
Present.
Sonia Reynolds.
Present.
Dave Whitelock.
Present. Thank you, Charlotte.
Arwyn Wilcock.
Present, Chair.
Carolyn Edwards.
Present.
Sorry, there's just a bit of feedback at the moment. Apologies. Councillor Carolyn Edwards. Was that you then, Carolyn?
Yes, present.
Yes, sorry, thank you. Councillor Wyndham Griffiths.
Thank you, Charlotte. Present.
Councillor Helen Clark.
Present.
Councillor Nicola Davis.
Present.
Then Cabinet members, Councillor Alan Lockyer.
Present, Charlotte.
Councillor Peter Richards. Councillor Richards, I think you're on mute.
Present, Charlotte. Thank you.
Thank you. Andrew Jarrett.
Present.
Angela Thomas. No. Kerry Warren. I think Chair, she's joining later, Kerry is.
Okay.
Chris Frey Davis.
Present.
Karen Wedmore. No. Julie Bowditch. John Hodges.
Present.
Alan Coffey. No. Robert Davis.
Yeah, present.
Says I've missed at all. Or any members at all?
Yeah, Angela Thomas, sorry, I'm having connection problems, but I am present.
Oh, thanks, Angela, sorry. There we are, Chair. I think that's everyone.
Thank you. Right, agenda item 2 is the declarations of interest. Has anybody any declarations? I see no indications. Anybody else? Charlotte, can you see any indications?
No.
No. Okay, smashing. Okay, so we now move to agenda item 3, with the 30th of January 2020. I didn't chair that meeting, so anybody who was present, can you confirm that they are an accurate recording of the meeting? Anybody wish to confirm for me?
You're happy with
Somebody,
the Chair?
Vice Chair, you chaired. No comments? I'll move on if necessary. The meeting of the 12th of March, are we happy that that is a true recording of the meeting? Yeah. There was a question raised in pre-briefing, but we'll deal with that through an email from myself to Democratic Services, just about the way in which minutes are expressed. Okay, we are now on to the meeting of the 21st of July. Are we happy that that is an accurate reflection of what was said? No indications? No, excellent. In that case, we now move to agenda item 4, which is a verbal update from Angela Thomas on care homes, domiciliary care and delayed transfers of care.
Apologies. If I could just come in, sorry,
Yeah, sure.
with minutes, they just need to be approved. So if someone could just move and second them for the 3, please.
Yeah, somebody move.
Chair.
Who was
I
that?
second.
Whoever, brilliant, thank you. I thought it was worryingly quiet, right? Okay, so we now move to Angela to give us the verbal update. I've had one pre-question from Councillor Woolcock, but the other members of the committee have said they'd prefer to listen to the account first and then indicate that they want to ask questions. So take it away, Angela.
Chair, sorry, change to the running order if that's okay. It's Andrew Jarrett.
Hello.
Yeah, are you happy for me to start? I just wanted to do a presentation to committee in the first instance, and then bring Angela, Rob and Children's Services in as we go. So I was hoping to cover 4, 5 and 6 all in one go, if that's possible.
Fine. Yeah.
Okay.
Everybody happy with that? Yeah. If you could take it fairly, oh, hang on a minute. If you take it fairly slowly, Andrew, so that we can keep track of what it is you're telling us, but off you go.
Okay, I'm a technophobe, as you know, so I just wonder about whether I'm sharing a screen at the moment.
You are.
I am. Good. Excellent. That's good. Okay. So as I say, it's really important as the director that I thought that I came here today and set the scene for what's happened over the last 8-9 months since the pandemic started in March. You know me, I've always strived on making sure that we have some transparency in our systems, and it has been difficult over the last, certainly 8 months or so, not being able to come here and update you on where we're going and giving you reassurance that we're doing the right things in the right order. So I'm going to cover quite a bit of ground today, talking about our emergency planning, the situational analysis as I see it and the heads of service see it, and both our achievements and maybe some things about the next steps. Now, as I say, transparency is important, and it's always a balance at the moment, I think, whenever I speak, to give you the facts and our assessment of those facts without causing undue worry, because overall, I can tell you that you have got an excellent workforce in social care who are both committed and will absolutely go the extra mile. And you have managers in place who are, some of the best able across Wales to manage what is an unprecedented situation. So I'm not trying to set out to worry you unnecessarily, but it is important as this committee that you understand what has been happening from our perspective. So as I say, if I can take and roll up 4, 5 and 6 on the agenda at the same time, I'll do some talking through my presentation. I'll then ask Angela Thomas to come in. She will talk about some other aspects and give you a bit more detail. I'll give you the overview. She'll give you some of the detail. And then I'll ask either Chris Frey Davis to come in for Children's Services perspective or Kerry Warren if she's here at that time. Are you happy, Chair, for me to progress on that basis?
Yeah. Any comments from anybody in the committee? Are you happy? Because it wasn't exactly what we were expecting. We were thinking about dealing with these as separate items. Indicate if you're not happy, otherwise I shall ask Andrew to proceed. Yeah, okay, fine. Take it away, Andrew.
Happy for me to proceed. Thank you, Chair. Appreciate that. Okay, so social services and social care is predicated on helping and supporting our most vulnerable people in the community. This often involves direct care, face-to-face contacts, assessments and development work, monitoring and evaluating through close working relationships with families and individuals, and challenging people and families to ensure that there is protection of those most vulnerable within our communities. COVID-19 has challenged our ability to do all of these things across social care over the last 8 months, and at different levels. And I think vulnerable people and their families, I would argue, have probably been worst hit by COVID-19. And I'll explain a bit more about what that means as I go through my presentation. So your staff and your managers have had to innovate and adapt, and they have done that. And I've been around the teams and spoken to providers. And as Angela will talk you through a bit later on, you know, they're all willing to go the extra mile to make sure that services to our most vulnerable clients are maintained. But I can't skirt over the fact that COVID-19 has hit us hard. It's led us to a position as your senior leadership team of having to make really difficult decisions that we didn't come into social care to make. And those decisions are around balancing the risk of care with the risk of infection, balancing where we concentrate our effort, where we have a lack of resources due to business continuity issues. So in other words, where staff are going off sick and where we haven't got the resources that we used to be able to rely on. And just like the NHS staff, social care frontline staff have put themselves and their families at risk in order to provide day-to-day support for those who otherwise wouldn't be able to manage. As I go through the response to COVID-19, you know, I do want to assure you that whatever decisions we've made, we've always put the most vulnerable people within our communities at the very forefront of our planning. So on my second slide, you'll see that, as I said, in March 2020, we moved to our emergency response. You will have all remember when we went into full lockdown as a nation. We were planning for an emerging crisis, and that emergency response was very much around shutting everything down. So we were expecting something that was overwhelming as far as the pandemic was concerned. And so we shut everything down, we cleared out hospitals, we made some decisions. A good example of a decision we made, you know, which you can argue might have not have been the right decision at the time, was around removing the local area coordinators from communities, because we were going to put them into the field hospital in order to make sure that there was throughput from patients being able to leave field hospitals when the system was overwhelmed. As it happened, that overwhelming position, we didn't get to that position, and we, having stood everything down, were managing the situation, if not comfortably, we had everything in hand. But if I just describe the emergency response to you, so very early on, we set up a community silver meeting, which had members from Swansea Council, the Health Board, the Third Sector, and ourselves, looking at how we were going to provide regional responses to the pandemic. That was meeting twice weekly. We had a gold meeting, which was Health, Swansea Council, and Neath Talbot Council, with myself as the director in Swansea, and one of their executive directors, meeting 3 times a weekly talking about, well, actually, what are the decisions that we need to make and how are we going to intervene in the crisis to maintain services that were most important. As we went through the process and as we've gone through the months, we went through the first wave of the first surge, and over the summer, you'll remember that numbers started to go down, and we, along with others, started to think about, well, what comes next? So we were balancing at that point an emergency response and what we were going to do post-pandemic. Lots of councils at that stage were talking about recovery and planning for recovery. We as a region and in Neath, Talbot, we weren't talking about recovery. We always felt that there would be more to this pandemic than one surge. And so we were talking about move into an adaptive phase where we could adapt to future surges and that we didn't move back to normal business until we were absolutely sure that we could maintain that. We didn't think it was going to be helpful to move into, delivering services and withdrawing them, delivering them, withdrawing them. That would have just created chaos. So in the summer, we did talk about a transformation program. We set up a board to look at that. But as you'll see, and as you'll know from the news, the numbers started to build up as we moved into the autumn. And I'll talk a bit more about that on a different slide. But as a part of our emergency COVID-19 work streams that we set up, which reported through to the Silver Command, we had a group that was looking at externally commissioned care. So you'll be aware that closed settings, and when I say closed settings, I mean residential care homes in particular, in this context, were particularly vulnerable and were hit hard in the first wave. The externally commissioned care group was set up to make sure that we were doing everything we could to support those residential care homes. As we went through the first wave, they also looked at other externally commissioned services, in particular domiciliary care and how we support domiciliary care. You'll remember right at the beginning of the pandemic, there were real issues around PPE, personal protective equipment, and us being able to source that, and Welsh Government and the English Government being able to source that. So we set up a work stream to look at, well, how are we going to provide the PPE that our care staff need across the whole sector. So this isn't just in the council, this was across the whole sector and across the whole region. And what we agreed was that Swansea would look to procure alternative provisions around PPE. And as a region, then we would both fund and deploy that on a regional basis. So we set up a PPE group, which continued to run. As we went into the summer, we realized that actually we needed a tool that would help us understand when we were moving into the next surge. We started to think about a whole system early warning system, which would tell us by looking at some of the numbers and looking at some of the practice that was going on when we thought we were going to hit another surge. So we've developed a whole system early warning program, which we analyze each week. It's probably the first in Wales, and I haven't seen that done anywhere else. And once it's not completed yet, we're well on the way, but once we've completed it, probably next week or so, we think that actually that's something which the whole of Wales will want to see. You know, this as I say, this information that will help us to understand where we're at in any particular surge, when it's increasing and when it's coming down, and what the impact of that is on our ability to continue to provide services. So I think that's really innovative, and that is, as I say, all but in place. We have expanded our hospital to home arrangements, incorporated rapid hospital discharge. So we very early on recognized that hospital wasn't the best place for people to be. Hospital was a place, whether we like it or not, where COVID spread quite rapidly. And so we were trying to get people out of hospital as quickly as we can. And in order to do that, we had to incorporate rapid hospital discharge. When we've got some time in the future and when we're talking about lessons learned, I could talk a bit more about our rapid hospital discharge process that we completed, around March and April of this year, and some of the lessons that we've learned for this particular phase. And also the Silver Command looks at any other urgent issues that require escalation. As I say, we meet twice weekly and we look at anything that's happening across the system and across the region that will either help us or need us to do something different. And it's important that we look on a regional basis because we have patients coming from hospitals in Swansea as well as Neath, Talbot, and it's really important that we. So excuse my dog. The joys of working at home. The dog's just started barking at someone who's just delivering something. So apologies for that. But yeah, so we look at anything that needs to be escalated, whether that's things that can help us or whether those are things which actually we need to take account of in the work that we do. So those were robust governance arrangements. We, as a gold group, we report to the regional leaders and chief execs group again twice a week, and we keep them updated. Individually, I've been meeting on a weekly basis with my heads of service, with the chair and vice chair of this committee, to make sure they're up to date. And so I think we do have robust governance arrangements in place, which are both able to meet needs and make decisions quickly, but also keep people informed as best as we can on the current situation and the current crisis. So some of the things that we've developed around protocols. So I talked about the PPE, personal protective equipment. We've got protocols in place about how we draw those down from the stores that we've got in the Swansea area, bring them to Neath, Talbot, store them here so they're ready for our staff to be able to use. We've also got protocols in place about how we then distribute those out to care homes and to our domiciliary care providers across the social care sector. We have a care homes protocol. We spent a lot of time at the beginning of the pandemic negotiating this with health, and the main element of that care home protocol is that we've agreed with health that we will never knowingly discharge someone into a care home who's infectious, so who has COVID-19. That's not the same across the whole of Wales. It's something which we've had to discuss at length with health, and means that they've got to test patients before they're discharged into care homes, and that care homes won't accept them until a test which says they are no longer COVID positive. Once we'd negotiated that before Wales and the Welsh government put something out to say actually this was an element of good practice. It should be followed across Wales. We've also got an emergency funding protocol. So you will be aware from Angela and myself in previous years that we've talked about some of the debates we have with health around who's funding what, and how much funding for each individual, and that can get quite protracted. And that's never in a service user's best interest. We recognise that in the pandemic we can't do that, so we've actually agreed an emergency funding protocol whereby if assessments haven't been made because of the speed of discharge from hospital, we agree an emergency 50-50 funding package so that people get the services that they need, and then we've agreed that we will resolve in the future what those splits will be. So what it's not doing is not impacting on either discharge, our ability to discharge people from hospital and get them out into a safer place, and it's not affecting service users and bringing them into the any disputes that we might have with health. So that was a really good protocol that we put together. Talked already about the rapid discharge process, so we worked really hard to make sure that we created something which was less bureaucratic to get patients out of hospital and back home as soon as we could. Both working with the third sector, and you'll see that further down on the slide, to ensure that people could go home with support where they needed it, whether that's low-level support provided by the third sector and community and our Safe and Well service in Neath, Talbot, or whether that is higher-level support through our domiciliary care provision, internal or external, or whether that was back to the care home of their choice. Talked about the externally commissioned care, so we've worked really hard on making sure that we are giving them all information that they need. And I know Angela might talk about this, but she and her commissioning officers have gone the extra mile to meet with residential care homeowners and providers, as well as domiciliary care providers every week, updating them and speaking to them and understanding what the issues are and trying to help them as much as we can. I talked about the third sector and community. They've been and you'll know this from the Safe and Well service, a key part of our response to the pandemic in keeping the system moving and allowing people to return home where otherwise they might have had to stay in hospital. The end of the first surge, we developed an overview report, which is in the public domain, and I can send this to you, based on lessons learned at the time. That does talk about, the way that we discharge people from hospital and some of the lessons we learned around that, but also the wider lessons around, how we hoped to keep in the future COVID-19 out of care homes. And there's lots of other work that's been going on a week-to-week basis that we've progressed to make sure that we provide continuity of service. So let me talk to you about the current situation. And this isn't the most current situation. And as you'll see, this is a regional graph or a table, and it shows Swansea and Neath Talbot. So apologies for that, but there's no way that I could separate the two, given that this graph is a regional graph. So you will see COVID numbers through, and you'll see the first surge there between March and April. And then you'll see, as I described, over the summer period, the numbers dropped considerably. And as I say, people were talking then about recovery and what are we going to do next? And we were saying, look, it doesn't feel like we've recovered yet. Let's not start planning on recovery. Let's plan for the next phase of this. And then as you see, as we move into the autumn period, you will see that figures start to increase and increase pretty markedly until as you'll see, that final figure for Neath Talbot, which, apologies. Hold on, let me just go back. You'll see that final figure for Neath Talbot, which was, just under 300 and just over 350 per 100,000 of the population. So things were really starting to hot up at that stage, and we were planning for the worst and thinking, actually, if this carries on this way, we're really going to struggle. So we were speaking to Welsh Government along with some other local authorities saying exactly that. The leader was very involved. And Welsh Government put in the fire break. The fire break was on the 23rd of October, if you remember, to the 9th of November. And as I say, before the fire break, we were at 358. Cases per 100,000, which is on the graph. After the fire break, just on a date that I picked, 19th of November, we were down to 231. So that you could see a rapid decrease in the number of cases that we were seeing across the region. I do have to report, though, that the figures plateaued pretty quickly, and today the incidence per 100,000 is 434 in Neath Talbot. So that's where, probably around where Swansea was at the time. And if you remember when Welsh Government, right at the beginning in April, Welsh Government was saying, look, local authorities will come to our attention and require our support if they get over 50 cases per 100,000. Well, we are by far exceeding that at this time. And in fact, a figure of 434 incidents per 100,000 puts us second across Wales as far as all of the local authorities are concerned. So that's Neath, Talbot now. We've had 130 new cases just in the last 24 hours, which is a significant increase over what we were seeing last week, where we were seeing 40 and 50 cases, new cases per day. And we have a positivity rate. So a positivity rate, if you haven't seen this, is for all of the tests that you do, what the percentage of all of those are that are positive. And if you remember, right back at the first wave, when we were talking about 5% was really worrying. When we were at 2 or 3%, we were thinking 5% was going to be worrying. And I think we just got above that actually in the first wave. Our positivity rate today is 22.2%. So for every 5 tests that are concluded, at least one person has been found positive. And that, I'm afraid to say, is the highest in Wales. So Neath, Talbot, as far as positivity rates are concerned, is the highest in Wales. Where that all leads to is significant pressure now on our services. And I don't know whether you see these figures, but certainly when you're talking about the impact that the rise in these figures have on our most vulnerable client group, it is significant. It also impacts on our ability to have continuity of service, because what those numbers mean is that we've got lots of people who work for the council, who work for health, who are off sick, or have to isolate because they've come into contact with somebody who is infected. So business continuity then becomes an issue the higher and higher these figures go. So let me talk about pressure on services. I'm going to talk about pressure on the NHS in the first instance, because pressure on the NHS will lead to pressure on services, social care services in Neath Talbot. So let me talk about the pressures. So with what we're finding across NHS and social care is that the pressures are very different to the first wave. If you remember, the first wave, everything got shut down. It's different this time for health. They are maintaining elective and routine services as much as they can, alongside treating patients with COVID. So that didn't happen in the first wave. First wave, as I said, everything got stopped, and they were just dealing with COVID patients. So at the moment, they're trying to deal with both. They have got issues around business continuity because they have depleted workforce. As I say, you've got people who are isolating, people who've come into contact with COVID and either have got it or can't come to work because they know someone and been in contact with someone who has. And their workforce has been doing this for the last 8 months, and so are stretched because they're covering for others, but they're also exhausted because of the time that we've done this. And of course, both health and the council now have additional responsibilities which we didn't have in the first wave, and that's around delivering ongoing testing, now delivering the vaccination. As we come up to that, we need staff to do that, and of course, if and when we move to opening a field hospital, having to staff that field hospital. All of those things weren't featured in the first wave of the pandemic. So if I come on to social care, so I've talked about staff before. This is different to the first wave because our experience of it is different to the first wave, because now what we're seeing is individuals and families who moved to look after their very vulnerable family members, who cared for them and said, no, actually, look, we're taking them out of care homes. We're not going to allow you to put domiciliary care in. We'll support them. Those families were able to do that because they weren't working at the time because we were all locked down. But actually, they've been doing that for such a long time now, and they're now being asked to go back to work. They're exhausted. So individuals, families, carers are becoming more and more exhausted as time goes on. The impact of that on our services is, more and more requests for respite, for individual support, and for us to open up services which we've had to close. So families this time, we're finding are struggling far more for obvious reasons, as I've outlined. We're seeing more and more individuals coming out of hospital who are more dependent on care, and that's due to acuity of need. So COVID-19 isn't something that hits the most vulnerable, and once they've recovered from that they recover fully. There's an acuity of need that comes with that. So even when they come back into the community, they need more and more support. So we're seeing much more demand on our domiciliary care provision. We've got a depleted, stretched and exhausted workforce in exactly the same way that health have. We've been doing this for a long time. We've all been working from home. Those who haven't been working from home and are on the front line, I can't really describe it, how difficult it is to work in full PPE kit. When you're doing, having to remember to socially distance, you've got masks on, gloves, pinnies, sometimes you've got visors on, really difficult to keep working through that all the time with the risk that you're going to catch this disease yourself. And also we've had the need to keep more services running, albeit they've been impacted by the infection control measures. So we've tried to keep some respite services running, in the knowledge that families and carers are getting exhausted. That's not been easy, and as I say, it's always a balance between the risk of family breakdown and the risk of us exposing people to COVID-19, and that's been a real struggle. And sometimes where we've taken the risk, that's backfired on us, and we've seen COVID get into some of our closed settings. So what we've seen rising infection levels in closed settings, which are our residential care homes, devastating infection levels, which leads to devastating consequences. And I know Angela will tell you a bit more detail about that. But whereas we'd hoped that we might have learned lessons to keep COVID out of residential settings, that hasn't happened. And wherever we've seen it get into those settings have really struggled. And it's, as I say, it's led to some devastating consequences. We've got rising infection levels in other care settings, which we didn't have before. So in our extra care services, in our domiciliary care services, in the first wave, we didn't see that so much. Now we're seeing that more and more, again, with impacts on our ability to continue to deliver the business. But also, just then putting more and more pressure on hospitals. And as I say, we're seeing a higher acuity of need, which impacts on the capacity of our domiciliary care services and external domiciliary care services to manage the visits to people who need those visits within their homes. So the actions we've implemented so far, for health, what they've already implemented. So they've opened extra wards in hospitals. They've brought in extra staffing wherever they can to manage this surge. They're continuing wherever possible to maintain routine and elective surgeries. How long they can continue to do that if the numbers continue to rise, I don't know, but they are doing that. So overall, health is stretched considerably. In social care, we've already implemented the following. We've maximised our existing surge capacity in community-based intermediate beds. So we've created more beds within some residential homes, and also flex staff across community services. Angela will tell you a bit more about that. And we have maintained some emergency respite services wherever possible. And that's been really important where we've tried to avoid family breakdown. And people come into care. So particularly around learning disabilities, we've tried our best to maintain some respite services, but by no means we've been able to provide those to everyone who needs them. Okay, so the further options that we are currently looking at. So as I say, the pressures at the moment are really high, and what that's led us to as a region and as a management group within Neath Talbot is to start thinking about, well, if this continues in the way that it's looking, what are the sort of things that we might need to do? And it's important for me to say that we have spent a long time avoiding doing all of these things. Okay, so we haven't implemented these yet, and we'll only do so in extreme circumstances. But these are the things which we're now getting close to having to implement. So one of the things that we could implement is opening a field hospital. So you'll know that we have now got one field hospital across the region. If we open that, the consequence of that for us in the community, for us as community services, so in social services, in Neath Talbot and in Swansea, is that health will have to staff the field hospital by utilising staff from within the community. So that depletes the community provision in order for us to open beds in the field hospital. And that will have a knock-on impact. So district nurses will have to go into the field hospital, and some of the clinicians that work in the community to keep people out of hospital will need to go into the field hospital to work there. So we've been trying to avoid opening the field hospital because it will put more and more pressure on community services. One of the other things which we could do is implement 7-day working across social services. A lot of the management groups across social services are already working probably 7 days, managers taking calls, responding to emergencies on a 7-day basis. But actually, there's going to come a time pretty quickly, I think, where we're going to have to ask all of our staff to work on a 7-day basis. And that's really just to make sure that we're able to deal with the crises that we're seeing. In extremis, we might need to reduce domiciliary care visits to critical care only. Again, this is not something which we would want to do, but so if we haven't got enough domiciliary carers across the county, we may need to say, actually, we might need to miss a visit out to somebody. So that means leaving a meal for them, but not doing 4 visits a day, doing only 3 visits. Not ideal, because we've assessed that these people need 4 visits wherever possible, but we might need to move to critical care only. What we have said very clearly is we will not do anything, we will not move to anything which directly harms people. Now, you might say, well, actually, if you reduce from 4 to 3 visits, that's harmful in itself. If it's going to be physically harmful to somebody, we wouldn't do that. We would find another way of dealing with that, and that might mean having to put them into a residential care or into hospital. We might need to move to a position where we limit assessments at our front door to look at safeguarding issues only, focusing on the immediate steps we need to ensure that people are safe, rather than the longer term well-being. So at our front door, we manage safeguarding issues, but we also manage people who have lower level needs to stop them escalating to higher level needs. Well, we might need to move to a position because of staffing issues and our ability to respond, to actually only doing safeguarding issues at our front door. In extremis, we may need to move to a point where we're limiting the review of care plans to those that are essential only. So you'll know from this committee, we've talked about this, that we've always felt it's really important that we review the care plans of individuals on a regular basis, make sure they're getting what they need, changing their services where their needs change. Well, actually, we might need to take a view that actually we'll only be able to do those that are essential. We might need to request that other agencies cover for each other within the domiciliary care market where business continuity issues arise. The consequence of this is that those receiving care might not be familiar with their carers from one visit to the next. So that's not something that we would want to move to. That's distressing in itself for people who are, having to have very intimate care. Having people that they don't know, strangers coming into their house doing that is absolutely not something which is ideal. But these are the things in extremis that we're thinking that we might have to move to just to make sure that they get the care that they need. And we might need to remove the strict time slots for domiciliary care visits, meaning that whilst people will receive the essential care they need, they may need to accept that care at different times. So at the moment, people request when they want domiciliary care to come in, and that usually happens then. They set it down, you know, I want to get up at, I don't know, 7:30, 8 o'clock. And that's set down, and that happens every day then. Well, actually, as things get more difficult and in extremist circumstances, we might need to say, actually, you will get the care that you need, but you might not get it in the time slots that you've asked for. And again, that's not ideal. So in conclusion, to reassure you, we've done everything that we can not to implement some of these extreme measures. We've always said that this is a timing issue, and what we don't want to do is we don't want to put something in train which we then don't need. We find out we wouldn't need to have done. So this is timings, and we've done everything we can to stop having to bring some of these things into play. So you can be assured that we won't implement all or any of the emergency responses unless we get to that extremist position where rising infection rates, increased demand and reduced capacity necessitate further action. In other words, that we can't cope unless we do it. So that if we don't do that, those most vulnerable won't receive the services that they absolutely need. We do recognise the significant negative impacts for patient service users, families and carers. We recognise that they've already had, a huge burden to bear over the last 8 months where carers, families have been looking after their loved ones. They're already very tired, they need a break. We recognise all of that and are doing everything we can to support, but we are as limited in some of the responses that we can give, and you see that by some of the things that we're contemplating next. And to reassure you, these actions wouldn't be being deliberated if we didn't think the critical nature of the current situation didn't warrant planning for a worst case scenario. We continue to hope that this can be avoided, but I have to say that the way the numbers have been going, and unless what I would call the mild restrictions that Welsh Government have put into place around pubs and clubs has an impact that I'm not expecting, then we are going to reach what we would call a super surge, probably around Christmas or New Year. And so we're having to plan to cope with some of that. So we're already in a situation where some parts of the system are in crisis, and we're having to support some of those systems. If numbers keep going higher and higher, we might have to move to some of these measures that I've outlined. So, Chair, that's where I am with my presentation. If I could just let Angela just come in very briefly to talk about a bit more of the detail from an adult services point of view. I think that would be helpful before we take questions.
Thank you for that. Angela, sorry.
Yeah, sorry, I'm trying to stop sharing my screen.
Yeah, that may be the problem. Can the rest of you hear me okay? Yeah, right. Andrew, thank you very much for that. It must have come as a bit of a shock to some members of the committee. Fortunately, not so much of a shock to me, as I've been privileged to be in these meetings on this, but I'm sure there'll be loads of questions. But let's go to Angela next. But just at this stage, can I thank you personally on behalf of the committee for the amazingly proactive work that you've been doing. You haven't been, to use a cliche, you haven't been caught on the hop. You've known what's coming and you've planned for it. And we are very, very fortunate to have a director who thinks like that. So goodness knows what sort of a state we would be in if we didn't. Right, Angela, let's hear from you now.
Okay, thank you, Chair, and good afternoon, everybody. I'll Andrew summarise there sort of the journey we've been on in the last couple of months. I'll try and bring the committee up to speed if that helps us to the here and now. So I could talk at length about what's happened in the past. I think it's more important that you know what is happening in the community today. So it has been a pretty few testing months for adult services, and I'm going to go through it in order of residential care, domiciliary care, day services, respite, supported living, and I'll summarise with a few other bits as well. So I start with residential care. We are in a critical position as we speak today. So in the last fortnight, we have had to send volunteers from adult services workforce into care homes. So if I give you an example, Andrew asked me to mention, we've got one home in particular where there are 34 residents have tested positive. District nurses told us on Monday that you can fully expect, if what's been seen in the past is that at least half of those residents will pass away. This is a residential care home, not a residential nursing home. Therefore, we don't have district nurses per se going into that home. But those district nurses would be expected to provide end-of-life care. And if I told you today that district nursing is 50% of its workforce is off, either sick or isolating, that is the problem we've got in the community today. So we've got 5 care homes at the moment where I am sending, when I say sending, where staff have volunteered to go in and work shifts. And I can't speak more highly of the staff who have just, at a drop of a hat on a Saturday morning, have got out to bed and driven to a home and just worked the shift, some up to 12 hours. And I've got staff actually working in homes today as we speak. In terms of residential care and residential nursing care, it's becoming very difficult to take any new admissions. Only 4 homes available, I think 20 out of 24 homes are in lockdown. So there are only 4 homes in Neath Talbot who are able to take any admissions. And that equates to 14 beds, 1-4, which is absolutely dire when you think we're talking hundreds. So this means discharging from a hospital bed is becoming very, very difficult, as is putting anybody in from a community. And I think just to raise for members, I suppose one of the biggest issues for us going forward is that given all the bad publicity residential care homes have had in the last months, families obviously aren't opting to put their loved ones into residential care. So I'm starting to look at it strategically, even though we're in the state we're in, because what we've got at the moment is the majority of our homes are all operating at very low occupancy levels, which means that at the moment they're being propped up by Welsh Government funding. When that funding ceases, and I know Andrew will be pressing Welsh Government that it can't cease, I know for a fact we've got 2 care homes, one very big home that are likely to fold in the new year. So that would mean, and I can't even be in a position to move those residents because I've got nowhere to move them to, because the whole market is saturated. Because what we're finding is that people come out of lockdown after 28 days, and within 3 days, somebody else is infected and it's a further 28 lockdown. So residential and nursing is a real problem. So the other issue to raise as well is in terms of nursing and agency staff. Between us and health, we're all fishing in the same pool. It's very, very difficult to get agency workers. There's all good reason why we don't want agency workers, because they are moving from home to home and from borough to borough. But equally, when that's all you've got, that's all you can take, because you simply can't. I mean, at one point at 6 o'clock last Friday, I thought I had 17 residents on their way to Morrison Hospital, which would completely silt up A&E. As it is, 6 went in, and we managed with the rest, but it is becoming very difficult. I suppose Andrew did mention this, and I'll mention it under each heading. We have had the most positive relationship with our residential care homes. So we have 3 weekly calls to them, so they can tell us what their problems are, what their staffing issues are. Are they having problems with their PPE? That's all gone away now. That was more at the beginning, but we do get a very good feel for what is happening in every home. So I can speak with confidence about that. We know our market and we know how these people are dealing. And I know Andrew mentioned that we get that regional picture, which is the best in Wales, or the only in Wales, but I've been privileged from day one of having all that information to hand. So I've been able to take decisions with confidence about when we've had to change things around. And I'll speak a little bit more about that in a minute. So yeah, the providers have been very, very complimentary about how we've helped them, how we've dealt with things. Partly this week, I thought, have we got too good a relationship? Are we, you know, they very much come to us when they can't get staff, but it's a balancing act. It's a balancing act all the way through, and I think we've got to err on the side of the fact that we're working with them and helping them throughout this. There, as well as all of that, what we have done in Neath Talbot, we've led the way. I think we've held weekly meetings with Public Health Wales, CIW, health colleagues, environmental health, and our staff. So weekly, we've been able to grab all the different sources of information that's happening across all the different areas. So it gives you a much better feel for what it is or it isn't that you're going to have to do. But as I say, at this point in time, and I got another meeting at 4:30 today, so we have these twice daily catch-ups to see what's changed from one day to the next. Perhaps it's worth me saying on that note, the data is changing by the hour. So Andrew and I were speaking yesterday morning, and he said to me at 11 o'clock, at what point do you think we need to press health to open the field hospital? And I said, no, we're fine. We're hanging on in there. It's difficult, but we're hanging on in there. By 3 o'clock yesterday afternoon, I texted Andrew to say, I think we better open them because things had changed that dramatically in a couple of hours. So it's very difficult. I can give you the here and now, but tomorrow could be a completely different story again. So I'll move on to domiciliary care. So what we did at the very beginning, and we continue to do, is we RAG rated all our domiciliary care calls. So we RAG what we consider, critical life is red, amber would be dreadful to do, and green. And when I say green, we haven't got any easy calls. This will be a call that's within your 4 days a day call. If you've got 4 double-handed staff, perhaps one of those might be prompting somebody to drink, prompting someone to take medication. So, they're not green as in, making a sandwich and leaving it there. They are some, but what we've got contingency plans in place, and I'll explain to you what we're doing here. So we've done all of that. I'm still concerned, and we missed it first time round, that we didn't get a bigger outbreak in domiciliary care. And even round second time round, it's still hitting the care homes more so than it is domiciliary care. I've got my own theory on that, and that may be that domiciliary care workers are not being tested, whereas everybody in a residential care home is. But God forbid they were tested, because I think it would probably wipe out the domiciliary care that we've got currently in a community. But what we're finding at the moment is this time of year is what considered to be winter pressures. So you've got elderly people being admitted to hospitals and becoming unwell in the community on top of COVID, because that's what happens this time of year anyway. As I say, the in-house we've managed, and we're still managing, and there's still some flow. External agencies have said to us in the last couple of days that they are seeing where there's a lot. If you think the majority is a female workforce, they're either grandmothers or mothers. They've got children in school, the schools are coming home and the class has been tested positive, they've got to isolate. So it's undoubtedly going to hit them at some point. And it's like a domino effect. It hits one and it just moves across. Again, we've got an absolutely wonderful relationship with these domiciliary care agencies. I personally have attended these meetings, particularly when it's hit hard times, and they've been very grateful for me doing so, to the point where what would normally happen now at this time of year is a domiciliary care agency to shut up shop. They will have done their rotas for now until the new year. They will move to skeleton workforce, and that would be it. We are meeting with the providers to say, can't do that this year. We can't force them, it's their private business, but we're saying, what can we do to work this together should the worst thing hit the community? And they've absolutely agreed that we'll actually pick up each other's runs. So if something happened in a Sandfields area and in-house couldn't do it, and they happen to be there, they would, it's almost like a military operation. We've got these rotas and everything together, but I can give you some confidence that all of that is in hand. And we've also got a backup group of people who are our community connecting team, some of our day services staff where they're closed, who will go in and provide maybe that prompting call or that, the sandwich call. So we are trying to make it, but it is a whole sector approach to domiciliary care, not an in-house versus external, which I think is absolutely excellent. If I move then on to day services and respite services, Andrew alluded to that it's been very, very challenging. It's become very challenging this week after Welsh Government sent the guidance out about Christmas visits and 3 bubbles, etc. So during the summer months when we were in lockdown, we were able to provide some form of respite out in the community. So we were doing a sort of in-reach service, going out and collecting people, taking them out for a couple of hours, nowhere near the hours that they were getting if they were attending a day service, but just providing some form of respite to families where we could, and they were grateful for it. As soon as we reopened the doors, or as soon as the lockdown was lifted, families were just ringing, can you take them? Can you take them? And we'd be saying, look, it's still dangerous, you know, with COVID, etc. Don't care, can't cope, can you take them? So it's been a real battle, and it still is. So where we've arrived at with day services, we're still in lockdown, our day services. Where we can open, you're providing very minimum. If I told you there are 70 people attending one day service, you're talking no more than 9 people, not 70. So it's minimal numbers, so it's very, very small. But where that is absolute family breakdown, and we're trying to avoid that. As it happens, many of our externally commissioned day services have also had to shut down now because they've also had positive tests, and they're in the same 28-day lockdown as residential care. Supported living, again, this is very, very challenging. Families who want to visit their loved ones in the supported living environment, or at least have them back home for overnight stays. The guidance that we just had recently from Welsh Government is open to interpretation. It says that visits at Christmas is a particularly hot topic because people obviously want to visit their loved ones and I suppose just to say to members, it's been one of these things, every decision you make, you're damned if you do and damned if you don't. So if we apply the guidance as it says, we allow these families to take their loved ones back on Christmas Day. Lo and behold, somebody contracts COVID, takes it into the supported living environment, and the worst happens. And all of these people will have underlying health conditions. So that is the position. I'm confident we're taking the right decision in as much as we consulted with all of the families, we've consulted with all our externally commissioned care providers. They've all given exact the same message. This is a risk, and we would prefer you not to, but if you're going to do it, the risk sits with you, not with the council. So we've been clear on that. Just a few other things then briefly. So a couple of weeks ago when the situation started to worsen, I called together a meeting with all the staff and asked if there were any willing volunteers who could come forward, and we sent a questionnaire out saying, what could you work? Could you work days, nights, weekends? Could you work in a care setting, in the community? You know, the whole range of questions we asked. And I was absolutely overwhelmed by 200 staff coming forward. You know, everybody's scared, everyone's afraid, nobody really wants to go into that care home, but the number of people who've just said, yep, give me my kit, I'm going. And that's, you know, and we have put a comms out to that effect on the internet, because I have been overwhelmed by that. Just a few other things that we've been doing. So the remodelling of adult social care, that is still going ahead. We're still having the meetings. We have appointed to a temporary principal officer. We are appointing to a temporary team manager for the Swansea Valley Pontedower area the week commencing the 14th of December. That will happen. So yeah, we're still keeping that on track, trying to talk as if it was business as usual. But we are now putting plans in place for 7-day working. We've got rotas coming out of our years for who can work at what time, you know, who can be the conduit for the dom care agency or for the residential care home. That can't be the same people and individuals for the next 4 or 5 weeks. So we're going to rota that as a principal officer group. I've mentioned to you contingency planning, that's all there. And yeah, I think I'll stop there, Chair. I could go on and on.
To say thank you, Angela, is the words just are not sufficient to express our gratitude as a committee as to what you're doing. I think I said to you a few weeks ago, I have visions of you sitting there with one of those great big maps and all the little people being pushed around on the map. How you can keep track of where people are needed, I am just amazed. And if there is one positive thing that's coming out of this desperate situation, it's this spirit of joined up thinking, where you've got external private companies and ourselves. Everybody's doing their best to make a desperate situation better. And that is very, very heartwarming. but some of the information we're getting is very, very worrying indeed. I can see Councillor Paddison indicating. Off you go, Suzanne.
Oh, thank you very much, Chair. I'd like to echo the Chair's statements 100%. You are firefighting to the nth degree. And as councillors, although we haven't had a lot of contact with you for reasonable reasons, we didn't want to overburden you. When I have had to have contact, I have to say that our staff have come up trumps, absolutely. So Andrew, Angela, all of your senior team, I think you're behaving tremendously well under such terrible difficulties. And I'm sort of almost hesitant to ask the question because on the agenda it says to include homelessness, and although you've told us so much about what else is going on, that wasn't mentioned. So my question was around homelessness. So what sort of preparation or looking forward, because obviously after the pandemic and into the new year, we know that lots of people haven't received their pay, they haven't received, their businesses may have folded. There's lots of things happening in the community which would possibly mean people behind with their mortgage or their rent. I'm just wondering if there is any forward thinking as to what we could do to put steps in place to limit the number of evictions in the future.
Sorry, Angela.
I could see Andrew indicating as well. Andrew or Angela to answer that.
Can I just come in very quickly? So, because I expect that homelessness will be, quite a big subject, and I know Rob Davis is here. We had expected to talk about homeless, so we will. Just wanted to say, Chair, and apologies for this. I'm actually on the interviews for the Director of Education. But I wanted to come and do this presentation to committee today. I thought it was really important. But I am going to have to leave probably in about 10 minutes time. Okay. So if there are any particular questions that anyone's got for me, then if you could front load those into the next sort of 10 minutes, that would be fine. As I say, I thought it was really important that I came here to give you this news. But I've had to step out of some interviews in order to do that.
Right, okay, let's get this under control. So we've got somebody who's going to specifically speak to us about homelessness. So can we put that on hold for a moment, Suzanne? Yeah, okay. Is there anybody, Arwin, I know you've got a question that you wanted to ask. As it is about vaccination, it could be that you might want to address that to the director in case he's got some inside information. Do you want to go next, Arwin?
Thank you, Chair. Yes, appreciate that. Can I just say that the challenges and pressures that you faced, all of you, maybe some right across the whole council, really, but clearly some departments more than others, and clearly social services has taken a right challenge and been under tremendous pressure here. And I'd like to echo everybody's comments so far in our sincerest thanks to you all for the tremendous work that you've been doing and will have to continue to do, I'm sure, for quite a while yet. I don't know, Andre, whether you did receive my question. I sent it in advance yesterday. I'll read the question. I sent this yesterday, so I'll just tidy up the beginning of it. And I said, we all welcome today's, which was yesterday, let's say yesterday's then, tremendous news that the Pfizer-BioNTech vaccine has been given approval by the regulator. The vaccine, quite rightly, will initially be targeted at care home residents and staff, as well as NHS workers. Are there any early indications as to when the vaccine will be available in Neath, Talbot? And will home care workers also be included in that first tranche of inoculations? And I asked that specifically, coming back to the point that Angela and you yourself have so quite forcefully and rightly made in your presentations, that of the pressures on the care home sector and indeed the hospitals as well. And if our home care workers are struck down by this or have to self-isolate, then that could add additional pressures on those two sectors. And incidentally, you've been talking, both you and Angela, for just over an hour. I think you could have been talking for a month and we still wouldn't have seen the end of it. And I do appreciate, Andrew, about the logistics of getting this particular vaccine, and it is regulated and governed by the JCVI. And also there are I just missed a note here as well, that I see that there was a call from Carers Wales this morning for unpaid carers to be first in line for these vaccines. So the question really is, do we have any idea as to when Neath Talbot will get its share and on the home care workers? Thank you, Chair.
Andrew, do you want to come in on that?
Yeah, sure, Chair. Yeah, just trying to think about how I frame this. Yeah, the Pfizer vaccine. So you're right, Councillor Wilcock, that care home residents and staff were sort of top of the list as far as that's concerned, along with NHS staff. The problem with the Pfizer vaccine is that logistically, as you say, look, it's really difficult to manage, we're being told. So it can't be moved once it's opened. It has to be kept at a very low temperature, minus 70 plus degrees. And so it's not thought that it's going to be right to roll that out to care homes. So that won't be rolled out to care homes in the first instance. It will go to NHS staff. And that's whilst we await the new vaccines that will be coming online. As far as availability is concerned, I don't know how available it's going to be as we this year. I do know that our first allocation, we've already been told what that's going to be for the region. We'll be getting that next week, but that is 900 vials only, which is 900 doses. So that has to then be repeated. So that's a tiny amount compared with what we were hoping for. As I say, logistically, it's really difficult to manage. And so the notion that whether it's domiciliary care in the first instance, whether it's other carers or whether it's our care homes, it's just not logistically possible for that particular vaccine to be used in that way. There are other vaccines that will be coming before Christmas that will be able to be more flexibly used. So I'm sorry, that's not good news. I understand that, but that's the reality of where we are.
Okay, thank you very much for that, Andrew. Before we let Andrew go to his next meeting, is there anybody who has anything specific that they need to address to the director? Bearing in mind, we'll have Angela, we'll have experts on homelessness and Kerry for children's services remaining in the meeting. Anybody indicating? No, right, Andrew, if we let you go, again, can you take our heartfelt thanks as a committee to the staff? It's quite amazing what you're doing, and do make sure that you don't burn out yourself as well. Okay, off you go to your next meeting. Thank you very much. Let's wave or wave at Andrew, right? Okay, I don't know where we're up to now. Oh, Angela, any specific questions to Angela next? Or Angela, are you indicating that you want to speak?
Only to say that the reason I didn't put homelessness into that presentation is I knew Andrew was presenting it on health and social care in that first presentation. So I've got a separate bit to talk about homeless, and Rob is here as well. So that's why I didn't include it at that time.
Okay, no problem. You also probably needed to get your breath back. Councillor Lockyer, are you indicating that you want to speak now? No.
No, sorry.
No, it's not you. Who is it? Who's this down here? Is it? Oh, it's Sonia.
It's me.
Councillor Reynolds, do you want to ask Angela a question?
You raised the work going on in communities with Safe and Well, and I'm sitting here thinking, is there more that local community organisations can do to support the domiciliary care shortage, or to provide that low-level care that can't be done, that isn't available because care agencies are struggling? That there is the sort of work that shopping and general support work that could be done, and there is a possibility that some assistance could be given with that at these times. So I'm just wondering and not expecting an immediate answer, but just flagging it up as a, is that possible?
Yeah, we've already had those conversations, Councillor Reynolds, so that is in hand. And if we do need to call on communities, that would be the first port of call. We're not there at the moment. And if I'm honest with you, shopping is not something we do anyway with the domiciliary care or in-house home care. It's usually personal care. It's usually very intimate personal care or medication where you're reliant on it to keep alive. It's not the low level stuff that went many years ago. But we are, you know, we will definitely, the local area coordinators are clued up. I'm meeting with them every month as well. So we are clued up in terms of the links between Safe and Well and themselves, and more so you in the community. So if we need to get to that, we could easily get to that quite quickly.
Thank you for that. Unless anybody else is indicating, should we ask Angela to continue? Yep. Okay, carry on, Angela.
Okay, so I'll just give you an overview of homeless then, because I need to go back to the beginning because it won't make any sense otherwise. But I've asked Rob. Rob's the principal officer who's been dealing with this day in, day out, and can fill you in on phase 2, etc., and where we're going. So basically then, at the beginning of the pandemic, Welsh Government instructed all local authorities to take all rough sleepers off the streets. Prior to COVID, we would always been dealing with roughly about 60 people a day at any one time. 60 people would be on our books, be it in B&B, be it in Beaufort House. That's the numbers we'd normally be dealing with. Also at the beginning of the pandemic, Welsh Government removed what's known as priority need. So this would, an example, easiest way to explain, somebody would turn up on a Friday at 4 o'clock and say, I'm homeless, my mother's kicked me out. And at that point, the officers would be saying, well, I suggest you go home and make it up with mum, or go and sleep with your friend for the weekend. That has been removed. So anybody presenting as homeless, we have had to accept as homeless. And what we have become aware of as the months have gone on is that, you know, youngsters have got savvy to this. They're presenting as homeless, and we are still doing the checks, and we're ringing the parents to say your son has presented, and they're saying, yeah, he's not coming back. And the reason being, they get additional points on the social housing ladder if they are homeless. So there's been a loophole that some of these people have found their way around. Rob and I have met with Welsh Government a number of times. We've explained it to them. I'll let Rob speak about the ludicrous bits of how they want us to build things for homeless people. But so that's where we're at. So anybody presenting, we have to take on our books. So as we speak today, Rob will have the absolute up-to-date figures, but the figures have doubled since they were in March. And we had to take over the Ambassador Hotel in Neath and the L&A Centre in Goitre, which has been full ever since we took them on. So the leader has given us until the end of March 2021 to use those 2 particular centres, albeit we know there's not going to be a solution at the end of March. What I can tell you is that our Cabinet Member, Councillor Richards, has been chairing a corporate group now, which myself, Rob, Karen Jones, Community Safety, all attend, because what thankfully people have realised, it's not just a social services problem. Homeless is a council problem, and that's been acknowledged. So we are now, with the last meeting was really quite helpful with different RSLs there who are looking to find solutions for us. So it was a very positive meeting, and I can see Karen's emailed me today, so there's another meeting in the diary shortly. I will say, I've talked about the workforce. You know, Rob's team, I have to say, they've been the ones delivering all the PPE to the care homes, to all the domiciliary care agencies. So because we weren't doing disabled facilities grants, didn't mean to say people weren't doing anything else. Everybody in adult services coming together for the good. And it's, you know, I really got a second to none team in terms of my principal officers. They've been absolutely superb. So I let Rob now go on to phase 2 and the Welsh Government funding and some of the nonsense that we've been having in terms of building.
Thank you. Rob, welcome to the committee. Take it away.
Thank you. Yeah, I think Angela covered it very well there, actually, with the homelessness of what's been happening. Just to give you a couple of up-to-date figures, we've had 1,333 applications since the 23rd of March for homelessness. Now, that is slightly lower than what we would normally have for that period in a year. However, as Angela mentioned, because the Welsh Government have removed the priority need, We've had a total of 294 households where we've had to put into temporary accommodation. Normally, for that same period, we'd probably be more like 120. So as you can see, it's doubled. Exactly what Angela said. We normally get about 50 people in emergency accommodation at any one time. Our figures as of this morning was 106 people. So you can see the demand for interim accommodation, emergency accommodation has gone absolutely through the roof. We've taken over the Ambassador Hotel. We currently have 35 people residing there. The LNA Centre, we've got 21 there, and we've got 15 people in the B&Bs in Swansea on Oystermouth Road. Now, that is causing a slight problem as well with Swansea, because they've got, I think the last figures I heard with them, they've got 90 odd people in their B&Bs. So they are struggling as well and want those places back, but we've got no other choice. We've also got 55 people in other locations, which includes our Beaufort House, Lewis Road, and various properties we lease off the RSLs. Now, at the start of all the pandemic, we pulled all the RSLs together and we have fortnightly meetings with them, basically to see what we can do. And I have to say, they've been brilliant. Titarian, they were, well, should I say, obstructive almost in helping us in the past. As soon as the pandemic started, they become very, very helpful. They've been doing whatever they can to provide accommodation. However, due to the ban on evictions and the low numbers of people moving on, there haven't been many voids coming available so that they can give us as many additional properties as we need. So our big problem, which is coming ever closer, is at some point at the moment, the date is end of March next year, that we have to take people out of the Ambassador and the LNA. Now that is 56 people we have to find alternative accommodation for if we take them out of the Ambassador and the LNA. Where we're going to put them is the big burning question. Now the Welsh Government, when they removed the priority need and asked for everybody to be taken off the streets, they provided what they call phase 1 emergency funding. That pays for the Ambassador, it pays for the LNA, it paid for emergency food, it paid for basically whatever we needed to get these people off the streets. That is still ongoing. They then, in beginning of June, they opened up what they called phase 2 funding. Now for that, we applied for various money to create additional units so we can place people in. Now this was opened up to the RSLs as well, so we put a number of applications in for a number of different properties, different schemes, including some revenue as well. But the demand on the £20 million that was in the pot was £65 million across Wales. So as you can imagine, we only had a fraction of it. The RSL schemes, we've got 16 units which have been approved on various different schemes. Some of them are new builds, some of them are conversion, some are different things. So they will hopefully be coming online, some by about the end of March, but hopefully all by about the end of the summer. Now our main scheme was Gelli Bron, which we put in, which the leader was very keen in us using. The Welsh Government had something that they called Annex D. Now that was basically like a building standard, a requirement which they wanted us to create these properties for. Now, as usual, the Welsh Government aspirations to exactly what we can deliver on the ground are slightly different. So at the start, we were very much encouraged to put in as much as we can, do whatever we can, and the Welsh Government will be very supportive of us. When it came to the crunch, for them to actually approve something, they became very obstructive. They weren't very helpful or flexible at all. So some of the schemes we put in, because they didn't meet the Annex D, they basically said, no, it's non-negotiable, there's no flexibility whatsoever, we cannot offer you the funding for a various amount of units. So that put us right on the back foot again. Now moving forward, we've had a provisional offer for Gelli Bron, but since we've evolved our discussions with them, we know that that is going to be reduced massively. So for us to develop that scheme, we're probably looking at a contribution from the authority of £1 million plus, which we know that is going to be very, very difficult. So we're actually in discussions at the moment with a couple of different RSLs of redirecting that money to a different scheme managed and run by an RSL, which we're at early stages now. And we've also spoken to another RSL about still the possibility of developing Gethigron with them possibly funding it. But then that wouldn't be going through the Welsh Government through their Annex D, so then we can then develop to suit ourselves. We have various models like the Beaufort House currently, where we've got 14 bedrooms, all shared community facilities, and that works perfectly well. So although the aspiration is to get totally self-contained units, yeah, totally agree with that. The actual reality of getting that on the ground is totally different. Whereas the need, if somebody's homeless and desperate for somewhere to stay, most people will accept somewhere that's got shared community facilities. So we're looking at a lot of different options at the moment, but there is that big problem of moving people out the Ambassador and the LMA. Some of you may be aware that we have had various issues with the Ambassador over the last couple of months. We meet every Tuesday. We have what we call a cell leads meeting, so all the different organisations we deal with, all the support organisations, the mental health, the drugs, the alcohol, all those agencies, we all meet together, including the police. So the police have been very, very helpful with us. And now I think we're probably the 6th or 7th week in the trot now where the police have said there's been no issues at all with the Ambassador. So that's very positive. We have changed the security, we put staff in there, we have our outreach workers in there every day. The staff at the Ambassador have been absolutely outstanding, I have to say. They've been very, very supportive. They are dealing with some difficult characters there. And we have had 3 deaths there as well from overdoses and 1 hanging, unfortunately. But to put that into perspective as well, those characters, they probably would have overdosed in a doorway or somewhere down a back lane or something if it wasn't for the Ambassador, because unfortunately they were drug addicts, and as with a lot of these individuals, they take too much of a dose that their body can cope with, and unfortunately they die as a consequence of it. So although it has had some bad press, I think we need to put that into sort of context with the whole picture of it as well. So it's been a very, very difficult time. The staff are all working from home. The staff have been absolutely worn to the bone now. They are worn out. They have got the COVID fatigue definitely now from the top right through to the girls on the ground. We have addressed that. We have spoken to more. We've done various surveys out to all the staff. We've spoken to the Welsh Government. We've got various different fundings coming from different places to bolster up the staff. We're moving some of them around, we're backfilling others. We're getting people acting up, we're sort of splitting different roles. We're doing as much as we possibly can now to sort of ease the burden on them as well, because the Julie James announced, not officially, because the Welsh Government are kind of backtracking on it now a little, that the removal of the priority leave is going to be permanent. Now, we were hoping that would have been brought back in, because that is our method to gatekeep people as they come to the door. Like Angela said, when people call us that phone Friday afternoon, we can say, well, go and speak to your parents or whatever, let them stay with you again. Now people are playing the system. We've spoken to the Welsh Government about these people playing the system. They are aware of it, but they're still adamant now that priority need will not come back in. So that means that the demand is going to remain high for interim accommodation. People can come to us, give us the story, and we have to take them. We can't now filter them out as we could before. So our need for interim accommodation is likely to remain at a high level. We were close to 150 at one point, but we managed to bring it back down a bit now. Dare I say it, I'm not going to say it too loud, but things are fairly, I'm not going to use the Q word, they're fairly settled at the moment in homelessness, which is good. We've had about a week and a half to 2 weeks now where we haven't had any major problems, so let's hope it continues like that for another few weeks. So I think that's about it in a nutshell, really. Happy to answer any questions.
Thank you very much for that. And again, please thank particularly the staff at the Ambassador for dealing with the issues that they're dealing with on a daily basis. I can see the Cabinet member indicating, but Suzanne, you indicated first. Do you want to come in?
Thank you very much, Chair. Yes, I can see that you're firefighting terribly hard at the moment with the conditions. one thing I would say is that I'm not averse to Welsh Government having the criteria that they wish to stick to. We are a first world nation after all, and I don't believe people should be homeless in a first world nation. But quite rightly, they should provide the funding to meet their criteria, and I don't think it should be passed on to local authorities. My second question is, maybe it's a bit too early to start thinking and talking with RSLs about what's going to happen when people do get evicted, because they will. There's an avalanche of debt problems coming down the hill, but on the firefighting side, when you have young people who say, look, it's just, it's not possible for me to stay home right now, and you were saying, can you go home and try and patch it up? Is there any risk assessment being made for those young people? Because as we all know, we're all being stuck together in houses, and while it might work for some families, for other families, it may spark terrible things happening. And I just wanted to know, is there an assessment taken place when we say to these young people, try and make it up with your parents? Thanks.
Thank you for that question, Suzanne. That raises an interesting point. Robert, do you want to come back on that? Angela?
Yes.
Anybody?
Yeah, no problem. When the individuals contact the service, the staff will ask them lots and lots of questions about their situation. If it is something like a parent has kicked them out, then they will try and mediate with the parents as well. So they will speak to various members of the family and try and get to the bottom of the story, try and find out exactly what's going on, try and find any support. We'll try and get other organisations, any of the external organisations involved as well, the support sides of it, to see if we can help in any other way as well. So we don't just sort of take them on face value, we take their word and then say, yeah, come on, you come. We will ask the questions, we will try and get to the bottom of what's going on. But those are not a great number of cases. That they tend to be the older people that will sort of contact us more anyway. But what we're also finding, like Angela said at the start about them getting more points to go onto the RSL registers, is the parents are colluding with them as well. So they know that we will contact the parent, and they've made up the story, and they will both tell us the same story. So then it doesn't leave us much choice then but to move them out. So we've had a couple of cases where we've got a bit of sort of evidence or intelligence to say that, yeah, it's not quite the truth that they're telling us, but we're not in a position anymore to say, sorry, you can't, because we don't have the power to do it anymore.
Okay. And if I may ask Angela about the forward looking for homelessness due to eviction when that embargo ends?
To be perfectly honest with you, Councillor Patterson, I don't think it's going to end anytime soon. That's all the indications we've been given. It's
well,
almost
that's fine then. Okay, thanks very much. Okay.
Thank you. Cabinet Member.
Thank you, Chair. Rob, personally, thank you and Emma and the team. I personally know how difficult this has been and many challenges we've had to deal with, because I speak to you on a daily basis. Personally, I've got major concerns about homelessness. It's a priority to me at this moment in time. I'm working extremely hard to try and support Rob and the team to try and resolve it. Meet with Julie James frequently, just discuss various things. Welsh Government aren't that forthcoming. They've made these rules and it's difficult for them to stick to the rules. It is a challenge in that area. Angela mentioned earlier on about the group I'm chairing at the moment. I'm very positive about that group. Social landlords are there, Titarian, Coastal, and we had really positive meeting. Rob attended and Angela a week or so ago. We have another one shortly, and I think we're all beginning to work together, and we're going to deal with homelessness. We are going to work through it together. And you know me, most of you, from my history, if I get my teeth into something, I'll really do my best to resolve it. it is going to be a major challenge, but it's something I think we can deal with. So just to allay your fears there, it isn't going to go away and all of a sudden the COVID will go away, possibly, and then we're still going to have the problem. We got the opportunity now to raise the awareness on this and resolve it as we come out of COVID. So please be assured we're on it and we're working hard with it. I can't explain how many hours is being spent on this. Right? As I said, Robert and I speak daily. Angela and I speak daily. It comes up on the topic all the time, and to try and cope with that and other things that nursing homes, hospitals, it is a major challenge. But we're prioritising that part of the business. So I hope that gives you some understanding. Thank you.
Thank you for that, Cabinet Member. Right, looking at the agenda, I can't see anybody else indicating. Councillor Richards, can you put your hand down, please? Angela, you still get your hand raised. Is that because you want to come back in again? No. Okay. Right. Is there anybody who would like to ask any questions about homelessness or about anything that we've heard so far on agenda items 4, 5 and 6 before we move on to agenda item 7? I can't see anybody indicating. Again, we could just repeat our thanks continuously, but please, officers, if you're with any member of staff who's looking exhausted and stressed out, please tell them that the committee are totally and utterly appreciative of everything that they're doing at any level. Thank you very much for that. Right, we are now unbelievably moving towards agenda item 7, which is the Forward Work Programme. The Scrutiny Forward Work Programme is attached for information. As you can see, it's been populated from the workshop that we had. Do members have any comments to make on the Forward Work Programme? I should imagine not, because it's so flexible. I mean, we can create a Forward Work Programme and then in the middle of a pandemic, we need to change it all again. So I would suggest that we leave it as it is and revisit it in January. Anybody, any comments on that, or are you quite happy? Thumbs up, nodding heads, etc. Thank you. Right, the Cabinet Forward Work Programme.
Do you want me to come in on that point?
Which one, 7 or 8?
The Cabinet Forward.
Right, brilliant.
Yeah, so members, just to let you know that that's going to be a standing item moving forward. We're going to keep the Cabinet Forward Work Programme on scrutiny committees, just for you to keep an eye on it. And if there's anything that you feel that's on there that falls under your remit, we can ask for it to come to that meeting to scrutinise, and that's just basically just to let you know what we're going to do moving forward. So if members are happy with that.
Thank you. Thumbs up. Excellent. Right, we're now up to agenda item 9, urgent items. We have one, but it's a private urgent item, so we need to take the access to meetings first. So I read out to resolve to exclude the public for the following items pursuant to Regulation 4 brackets 3 and 5 of Statutory Instrument 2001 number 2290 and the relevant exempt paragraphs of Part 4 of Schedule 12A to the Local Government Act 1972. Oh, it's been a long meeting. Can I have
I move, Chair.
And a seconder to move into private, please? Somebody propose? Thank you, John. Somebody to second?
Yeah, second, Chair.
Thank you, Councillor Woolcock. Right, at this point in the meeting, I'd like to thank any members of the public and press for joining us. Could I please ask that you now leave the meeting? Could I also please ask that the recording of the meeting now be stopped?